Hi everyone, we have Dr. Stephen Lewis, most decorated spine surgeon in Toronto, Canada, and we always get questions from patients who ask us what's scoliosis and who's the ideal candidate for surgery for adolescent idiopathic scoliosis surgery. Dr. Lewis?
Well, I mean, for the pediatric population, there's like the two kind of groups, is the ones that are still growing and the ones who finish growing. And so for the ones that are still growing, I think you have to look and see where their stages of their growth and the size of their curve and their progression, and consider non-operative maneuvers like bracing and things like that in the appropriate patients. The ones who've already broken through and gotten into surgical range, well, those would be obviously good candidates for surgery. And on the other hand, you have those who've already finished their growth. They're more than 2 years after their menarche, and they're looking for, they've had a large deformity and they're not happy with it. It's hard to put an exact number on it. So I know there's a lot of cutback, whether it's 40 or 45 or 50 degrees, but some 50 degrees don't look so bad, some 40 degrees look bad, and so I don't like to use a number per se, but definitely visible deformity. A lot of them have some coronal or truncal imbalance that they're not happy with, and those are the ones that would probably do well even sometimes with smaller curves. But definitely curves that are not responsive to non-surgical treatment, and those that are patients who are kind of unhappy with the way their back is at the conclusion of their growth would be good candidates to have surgical correction.
Thank you, Dr. Lewis. Another question we always get from patients: what are the risks and complications we should expect from scoliosis surgery in young adolescent patients?
We don't take any of these surgeries lightly, and obviously they're quite major events for a patient and a family. And despite the warnings, it's hard sometimes to get around all the risks. And usually it's a very safe procedure for AIS, and most of them do very well. You do obviously have to warn them. The main one, obviously, that most people are worried about is neurologic complications, and thankfully those risks are very low in centers that have good neuromonitoring and good imaging and things like that. So we don't take those lightly, and those definitely have to be addressed. Common ones would be a blood loss requiring a blood transfusion, which is something to discuss with the family, and blood conservation strategies, as well as infection, which thankfully is not very common, but is definitely a risk, and it does require multiple surgeries if it does happen, including potentially even needing to take all the implants out. So those would be kind of the main ones we obviously discuss. And then the risk of having chronic pain in the area.